Dr. Diez, you did tell us that periodontal disease is can be a life-changing, a life-threatening disease. People just don't know it. Very few people will get diagnosed with death by periodontal, but they will get diagnosed by death by heart attack and kidney failure. And that could possibly be, the periodontal disease could have very heavy, if not completely, have contributed to it. Now, that said, we have talked in great detail about that on another video. Tell us about the advances in periodontal disease, because I have heard they are great, fantastic, and you have told me in another, off screen here, that you have some very advanced machinery which few people have.
Yeah, we're one of the few offices in the Bay Area who are doing laser periodontal surgery. The nickname for it is LANAP, and you can find information all over the internet. But in very simple terms, traditional periodontal surgery, your gums are truly filleted open, the bone is ground down, and then your gums are trimmed and sewed back up. Very uncomfortable, very painful, although necessary, but it's just not a pleasant procedure. Your teeth will never ever look the same after traditional periodontal or gum surgery, because the gums are cut and trimmed. The teeth end up looking very, very long. In the last 20 years, there's been a lot of research done on lasers. Well, we have the only FDA-approved laser to treat periodontal disease. And you don't cut the gums, you don't cut the bone, there's no sewing up. I've actually had patients go back to work the same day. We don't recommend that, but I've never had a patient not go back to work the very next day. The procedure is so much more comfortable. The end result it is just as successful as traditional cut and sew surgery, but without the discomfort. The teeth end up looking the same because we don't cut the gum. Typically, the gum heals in the same exact position it was originally in. So you end up looking the same. Your gums are just healthier. It really is a miracle of science, the way the laser works. It's unbelievable. It really is.
Well, tell me, if you don't cut anything, because lasers can cut things, so apparently you don't. What does it do? Does it massage it? Does it circulate it? Does it kill the bacteria? Well, just give us a small little, what does it do?
The laser, it actually, and you have to understand now, there's some of the stuff that's happening after laser surgery, they don't know exactly why it happens, but up to a few years ago, well, let me say this first. The end result of gum disease is that gum disease destroys the bone that holds your teeth in place. But once the bone is destroyed, it doesn't come back. It doesn't grow back. Since they've been using the laser, we are actually getting bone to regrow. Never, ever have we been able to do that. They don't know why that happens. But one of the things the laser does is it sterilizes the infected area. Okay? But not just temporarily. It's a permanent sterilization. Gum disease is caused by bacteria. When you go in there with a laser, you are eliminating this bad bacteria that causes the gum disease. You mentioned about cutting. The laser does remove some gum tissue, but it's kind of the inside layer of the gum, the part that nobody ever sees. It's the unhealthy part. And that is part of the sterilization process also.
Any blood involved in this thing? Any blood involved in this laser surgery?
Very minor. It's done in a few different steps, but again, very, very minor. And the last step of sterilization, as we lase the tissue, we purposely go in with the laser at a different setting, and we clot the tissue. So again, the patient pretty much walks out of the office not that much different than the way they walked in. It's not like you see patients walk out of a surgeon's office and their mouth is full of gauze or they're all taped up. That's not the case.
Beautiful.
You don't have to do anything like that with the laser.
Beautiful. And is it one visit for the whole mouth? Let's just assume a guy has a whole mouth. He needs not everybody needs a whole mouth. Some need one quadrum here, one there, or whatever. But let's just say a guy who is in pretty bad shape. Is it one visit or?
We do it either in 1 or 2 visits. It's more common to do it in 2 visits. But we leave that up to the patient. We've done it both ways, and both ways have been very successful.
Great. Absolutely. Now, is this type of laser treatment, can that be used and applied in early stages also already? So that, or do I have to wait to get very bad before this can be applied?
No. Like with most diseases, the earlier you catch it, the better you are, and the higher rate of success. So, yes, the laser has done some amazing things with patients or teeth that used to be considered hopeless, and the laser has actually brought them back. But that's not to say that's the only type of patient you treat. It's always best to catch it when the disease is starting. The success rate is extremely high if you catch it early.
Right. Well, here you have it. I'll ask one more question here before I end off. There's those terms out there: periodontal disease, periodontitis, gum disease, gingivitis. Is that all about gum disease, just different stages? Do we as patients need to analyze what is what or not really?
Like you said, it's different stages. If a patient is seeing their dentist on a regular basis, their dentist is going to tell them basically in very simple terms what their condition is. So, if you have gingivitis, it just means your gums are a little inflamed and you probably need to brush and floss a little more and see your dentist a little bit more often. When you start getting into stages like periodontitis, that means you're having there's a bad effect on the bone, the foundation of your teeth. And then when you hear the word periodontitis, you have to take that a little more seriously, and treatment is usually a little bit more aggressive.
All right. Well, good. Thank you very, very much for this information. It's good news, really good news.
Thank you.